Hey guys, it's Dr. Adam Nally coming to you live at lunchtime. I have about 3 minutes, so I thought I would define what a ketogenic diet actually is. I have a lot of people come to me saying, well, I'm trying to do this ketogenic diet, but they're not actually doing a ketogenic diet. They're doing low carb or a version of low carb or even paleo, and they think it's ketogenic. So let me actually define what a ketogenic diet is. What's the definition in my office, and what have I been using for the last 14 years? Well, number one, a ketogenic diet is a diet that produces ketones as a primary fuel source. Now, the body, if you eat the standard American diet, is going to use glucose as the primary fuel. Usually 85-90% of the calories that you're taking in are used as glucose in that dietary type, if that makes sense. When we shift to using a ketogenic lifestyle, your body's still going to be making some baseline glucose levels, and it'll still be producing baseline insulin levels, which are necessary for brain function, and the liver does that in conjunction with the pancreas. But the rest of the body is using ketones as its primary fuel. So 90% of what your body's using, roughly, or up or down, depending on what your diet intake is going to be coming from ketones. Now, what's a ketone? A ketone is essentially a short chain fat. It's medium chain fats or long chain fats that have been broken down into a usable form of a fat, either beta hydroxybutyrate, acetoacetate, or acetone. And these can be used as a fuel source for various cells of the body, throughout the body. So how do you do that? Well, number one, you've got to lower the carbohydrate intake low enough that your insulin level drops to a baseline. That is usually around 20 grams of carbohydrate. Now, it may take your body anywhere from a day to 5 days, and I've seen some people it takes 2 weeks for them to get into a ketogenic state, because you may not be able to absorb the fat you're taking in as rapidly. For many people, it takes up to 3 months to really truly fat adapt and be efficient at absorbing fat. So step number one, you've got to lower the carbohydrate to less than 20 grams of carbohydrate per day. Now, the second part of a ketogenic diet is that you're giving yourself now fat in order to use as fuel. Initially, when people start a ketogenic at my office, we let them have unlimited fat. There's not a big deal because they're still fat adapting. They're still trying to absorb the fat, and they're not going to absorb all of the fat that they eat in those first few months. Their body will absorb as much as it possibly can. The second step, or the second challenge, is that you think that they should continue eating that much fat. Now, let me define a ketogenic diet as a high-fat diet. Now, by definition, a high-fat diet is a diet that's greater than 30% of your calories come from fat. If you're truly doing a ketogenic lifestyle where I start you at, that roughly ends up being 70 to 75% fat when you're doing it the way we do it. And if you want to check out my website, docmuscles.com, I have a whole training program, a whole ketogenic lifestyle program that gets you started, tells you how to do this. So you got to check that out. Go to docmuscles.com, check out my work with me, or my Ketogenic 101 lifestyle page, see what that can help you with, and that'll get you started. I've done tons of videos on this and talked about it before, how much protein, how much fat, but to this baseline, so carbs less than 20 grams, fat is at least 30% of your calories or more. Often we start around 70%. Sometimes we go higher, sometimes we go lower, and that depends on where you're at in the ketogenic stages of training. I find that there are really 3 stages of lifestyle in a ketogenic lifestyle, and we'll talk about that another time. And then we want to just give you enough protein to maintain muscle mass and maintain skin and hair growth. If you're noticing hair loss, if you're seeing other challenges like that, it's often a problem with the amount of protein you're taking in that regard. So now, a high protein diet is greater than 30% of your calories coming from protein. When you're doing a ketogenic lifestyle correctly, it's high protein and high fat at the same time by medical definition. Not by definition of your trainer, but by medical definition is how I'm talking about that. So hopefully that'll get you started. That's a little 3-4 minute blurb on what exactly is a ketogenic diet. Check out more videos I'm going to leave here on YouTube, and hope you'll have fun. Take good care, guys. Talk to you soon. Bye-bye.